Okay, so this is mindfulness-based cognitive therapy for groups. This is a presentation by graduate students at California Baptist University. Our group included Anna Abina, Tina Esparjani, myself, Andrea Solis, and Chris Robert Wagner. And these are the slides that I am presenting my portion of the group project for Andrea Solis. So the history of MBCT, it's based on an 8-week group mindfulness-based stress reduction program developed in 1979 by John Kabat-Zinn at the University of Massachusetts Medical Center to treat chronic pain patients. MBSR was found to be effective in treating chronic pain, chronic health conditions such as heart disease, gastrointestinal disorders, high blood pressure, HIV, cancer, sleep disorders, and addiction. They went on to extrapolate it for use with anxiety and depression. It was used for, MBSR was initially used for palliative care. The way it works is the goal is to reduce the emotional distress induced by anticipation of future pain and suffering. So chronic pain patients, or maybe end-of-life patients who are experiencing emotional and mental distress because of their current pain and the pain that they anticipated to come, which they would maybe think would be worse. And so that extra level of stress would affect them physically, mentally, and emotionally. So the goal was to reduce that meta stress caused by the biological affliction. So they found that even brief training, like 4 20-minute sessions a week, reduced the cognitions related to the unpleasant sensations of pain by 57%, and the intensity of the pain by 40%. So the patients were able to tolerate the pain to a greater degree with less distress. And the efficacy shown with patients whose tolerance had rendered pharmaceutical pain management ineffectual. So these chronic pain patients got to a point where their tolerance was so high for like opioids or morphine, whatever pain medications they were given that the pain medications were rendered ineffectual. They didn't work anymore for them. So they found that mindfulness-based stress reduction, like meditation and breathing techniques, was as effective, or at least as effective if practiced regularly, as opioid pain management. So the history of MBCT continued is that the attention training techniques found in the MBSR, the mindfulness-based stress reduction program that John Kabat-Zinn created, were melded together with cognitive behavioral therapy techniques such as decentering to create MBCT, mindfulness-based cognitive therapy as we know it today. MBCT was initially developed to treat major depressive disorder in order to decrease relapses, sort of trying to head off the relapse as the patient saw warning signs that a relapse was going to be triggered. MBCT also draws from ACT, acceptance and commitment therapy, to increase psychological flexibility and promote cognitive diffusion. In other words, trying to teach the clients to externalize the problem so that their ego identity wasn't fused with the problem. So I'm experiencing depression versus I am depressed. MBCT strays from CBT's focus on changing the content of thoughts to changing the relationship to thoughts. So we're not trying to change the fact that we feel depressed, like we may not be able to change that, those cognitions related to depression, but MBCT would want to change the relationship to the thoughts. So as seeing them as impermanent and mutable, accepting the thoughts instead of trying to resist and push them away. MBCT is a third wave behavior that focuses on non-reactivity, which moves the emphasis away from analysis and problem solving that you see in the first and second waves. So we're not trying to, with the case of depression, for example, we're not trying to analyze when and where the depression initiated or what caused the depression. We're not even trying to solve the depression long term. With the goal with MBCT is just to be able to experience feelings and sensations related to depression without reacting to them, without needing to do something about them. So we want to reduce maladaptive behaviors, perhaps, so that, if the person is feeling depressed, then they don't abuse substances because of it, or any other types of maladaptive reactions. So the central tenets: stress negatively impacts cognition behavior, and they found that biology is affected as well. Stress accelerates aging at a cellular level in the body, contributing to disease. They found that telomeres, which are sort of like a biological measure of the aging process, are found to be shortened when the person is under a lot of stress, and those telomeres are a marker of like the length of life. So life is shortened due to stress. And the stress additionally creates cognitive and behavioral stressors. So physical stress leads to mental stress, and then maybe stress that occurs because of maladaptive behaviors. So the definition of mindfulness is the awareness that arises by paying attention to the present moment on purpose, non-judgmentally. The mindfulness perspective on the cause of suffering is that suffering is caused by wishing something to be other than it is in the present moment. So, I don't like that it's raining outside. I wish it wasn't raining. This is causing me stress and suffering because I wanted to go to the beach, and I'm fixated on the fact of wanting something to be different in the present moment when there's no possibility of that happening. Or I'm suffering because a loved one has passed and I wish that hadn't happened. This is something, a fact that is not mutable, that cannot be changed. And so my focus on wishing circumstances to be other than they are causes me an additional layer of mental and emotional suffering. Having a wise relationship to suffering can decrease the amount of associated pain experienced. So again, that would refer to a wise relationship to suffering would center around acceptance of circumstances as they are, and even acceptance of the experience of suffering versus trying to eradicate it or change it. Attachment and fusion with cognitive distortions create suffering. So spoke about that a little bit already, but a fusion with thoughts like maybe depressed thoughts. I'm worthless, I'm not good enough, and having your ego identity fused to those thoughts creates suffering versus being able to externalize that and see that those distortions are skewed, not based in reality, challenging the validity of them. So bringing awareness to automatic thoughts and ingrained schemas can reduce reactivity. And that's just training awareness to see those automatic thought patterns as they arise and notice, okay, I'm caught up in a mental loop or I'm ruminating about something. And then you can you have the opportunity to interrupt it. The central pillars of mindfulness practice, there are 7. The first is non-judging. The mind is constantly judging intrinsic and extrinsic experiences as either good or bad, which creates mind states of either clinging or aversion, or it could be a disorganized combination of the two. Then behaviors emanate from these cognitions. So non-judging strives to allow the objective experience of stimuli without reacting to it contextually. So our brains are wired to be little computers that take in information, and then we categorize it. We judge it as good or bad. And then we have emotional states based on those judgments. So I like this, I want more of this. So you cling to something, whether it be, a relationship, a state of being. I feel happy. I don't want this feeling to go away. You're clinging to it. Or it could be aversion. I'm suffering. I don't want to feel like this, and you're trying to push it away. So non-judging would strive to just notice things, circumstances, without reacting to them. Patience is another pillar. Exercising patience acts to diffuse reactivity. So the more awareness that's cultivated, the more patience will be cultivated, and you may experience less of an impulse to be reactive. Beginner's mind refers to a state of open-minded awareness, which applies a mindful effort to foregoing expectations and predictions about experiences as they arise. So you're just open to seeing what might be instead of prejudging or placing expectations about what an experience might be, anticipating an outcome. Beginner's mind just leaves you open-minded to experience whatever might arise. Trust would be a sense of confidence in one's intrinsic intuition. So trusting in the intuition that you experience when you are mindful to pay attention to it, and trusting that you have the ability to self-regulate. Non-striving refers to the willingness to experience life as it is, again, without expectations or attempting achievement of a particular outcome. So even with MBCT, practicing mindfulness techniques, you're willing to just practice the techniques and let the outcome be whatever it is without attaching an expectation of what the result should be, so that you aren't discouraged from practicing if you don't achieve the desired result. You practice self-care just for the sake of self-care, for example. Acceptance is experiencing and acknowledging the present moment as it is. It doesn't mean that you have to like it, but you accept it. You're not in denial. You're not trying to attach a false narrative to it. You just accept circumstances as they are. And letting go is relinquishing cognitive and emotional fusion with clinging and aversion. So you're able to relax your grip on wanting things to be a certain way. You just let go of those expectations. You let go of the resentments, mental distress that accompanies being attached to a particular outcome, result, or state of being. the MBCT's view of human nature, human beings are biologically driven to seek pleasure and avoid pain, both physical and emotional. An example is that the pleasure of eating extinguishes the pain of hunger. The pleasure of successful interpersonal attachments extinguishes the psychological pain of isolation. Um, so we are driven to seek pleasure and avoid those painful things in life. But the thing is that physical and psychological states are impermanent. Thus, human beings are left in a chronic state of dissatisfaction. So everything has a beginning and ending. Um, no physical state is permanent. The body will change and decay. Psychological states are impermanent. There is no way to be happy all of the time. Those things will pass. So we're constantly chasing after a state of permanence that we find pleasing, which cannot happen. So along those lines, human beings suffer from destination addiction, the idea that happiness, contentment, or relief from suffering lies in some future moment or some future context. So we're constantly dissatisfied with the state of the physical world, our physical world, our emotional world, our psychological world. We're just always dissatisfied with it to some extent when we are in the mental loop of destination addiction. We're always thinking, okay, when I lose 5 pounds, when the cancer goes into remission, when I know I don't feel depressed anymore, then I will be happy. And then you may achieve those states of being for a particular set period of time. But when those states of being change, when circumstances change again, then we're constantly chasing after satisfying our desire for contentment. Most mental distress results from the ability to mentally inhabit the present moment. So the human mind defaults towards automaticity, habitual thought patterns. The ruminating mind is vulnerable to depression. So when we find ourselves depressed, often we're thinking about the past and we're feeling regret or resentment. And most often when we are feeling anxiety, our mind is in the future. And so both of those states exist outside of the present moment. Future-oriented thought or past-oriented thought exists outside of the present moment. So the more that we can inhabit the present moment, the higher degree that we will experience reduction of mental distress. And finally, the mechanisms of change. My MBCT focuses on an increased ability to self-regulate, the capacity for emotional regulation. So it strives to increase somatic and cognitive present moment awareness to identify thoughts and feelings as they arise. So noticing feelings of anxiety, perhaps you have a quickened respiratory pattern, you're breathing faster, maybe your temperature rises, you start to sweat, or you feel restless. So those are some somatic symptoms of anxiety. Noticing those physical triggers can alert you to the fact that you may be in a mental loop that is contributing to an increase in anxiety. If you're able to notice those things ahead of time, you could potentially perhaps ward off a panic attack, use some coping skills. So we want an increase in ability to tolerate uncomfortable feelings and thoughts and sensations without reacting to them. So just noticing, okay, I'm feeling anxious, but I'm going to sit with these feelings. I'm going to use my breathing techniques and wait for the anxiety to pass, being able to tolerate it without having to jump up and want to do something about it, especially something that may be harmful to the self. We want to reduce fearful anticipatory thoughts about future pains and stressors, which one might experience. So again, recognizing that those are not facts, they're not reality, they're future ideas about what might happen, and there is no threat directly in front of you in the present moment. And then disidentifying with painful emotions and sensations by noticing and externalizing those metacognitions, judgments, and narratives that accompany them. We spoke a little bit about that. Examples of those judgments and narratives, the metacognitions might be, I don't like this. When is this going to end? Why does this always happen to me? Things are never going to change. I won't be able to withstand this pain much more. This is awful. I wish this feeling would go away right now. So when we can notice those metacognitions about what we're experiencing and feeling, then we can diffuse them and take the power out of them by disidentifying with those, recognizing them as just thoughts without attaching to them and releasing those narratives and judgments. And so that is my portion of this MBCT presentation. And great once again to take one of your classes, Tony. It's not the same being virtual, but thanks for all your communication and help when there are questions in the class. So thanks so much.